when I made the decision to not go back to physical therapy, I can do my physical therapy things at home and that would save me some time, that I just need to have the surgery, okay? This is the 2 months into this. So I made an appointment with my neurosurgeon to go over that myelogram that we had before and see what his recommendation is from that. And right before I went to see him, I went back to my pain management for a follow-up, and he says to me, you really need this stimulator. And I said, I'm not doing the stimulator. I joined groups, I've talked to several people that have had it, and after researching it for myself, that's just not something I'm willing to do. I would rather have the surgery than to go through that. I hope he changes and I can continue to keep going to him, but pretty much he said, then there's really nothing else I can do for you. And I said, what? That doesn't make sense. Like on our first visit, you said that we could try Botox injections in my neck and my forehead. You know, can we try that? He said, well, yeah, we can try that. He said, but short of that, there's just not much more I can do. And in my mind, and this is where I'm at right now, still with this doctor. So I'll keep you posted on how this goes. But you know, in my mind, it's like I have muscle spasms, I have inflammation, and I have pain. So maybe it's a combination that I need of something for the muscle spasms, something for the inflammation, and something for the pain. I call it a cocktail. He didn't seem interested in doing that. He said, I'll try these Botox injections, which I'm still waiting on. And you can buy this CBD cream from me. It's $100 for this little thing and see if that helps. Yeah, it doesn't do much. So I felt pretty deflated. Then we go to see my doctor, the one that did my back surgery, that I'm going back to, that I have a lot of faith in because he healed my back or made me feel better with my back. So Mike and I went to the doctor and he looked at the myelogram and he said, you need an ACDF, anterior cervical disc fusion of C3 to C7 in your spine. And I had researched it a lot and I'm in a lot of groups and I was okay with that. I was first concerned about my mobility, and he said that's not a problem. He said, I have people that do photography and jump out of airplanes with multi-disc fusions. They go on and live, normal lives. The only thing you may not be able to do is if you did ACs and crawling in an attic or something, that might be difficult, but I don't do that. So I was okay with having the neck surgery, and we listened to him and decided, okay, that's what I'm going to do in January. He showed me my neck and on the spine where you can see that it narrows. He said that's supposed to be like the same size. That's what I now know is a spinal cord. So there's two pieces of the spinal cord that should all be equal. Mine isn't. So that's showing the disc protrusion at 3, 4, 5. And then I've already been fused at 6, 7. And he showed me the nerves, where this is the only normal nerve that I have, but look at all these other nerves in your disc that are being compressed. That scared me. Why did it scare me? Because I have already this permanent nerve damage that I've got to live with for the rest of my life. And I do realize that where I'm at right now, I've got big decisions to make. And the decision that I have to make is a big one, and it's scary. It's a scary place to be. But we decide that we're going to go ahead and going to do the surgery. Mike feels very comfortable and confident with him, and I do too. So I start making a list in my phone because I think of these things. Like then I research and I'm in these groups of, well, what about swallowing? Because that's an issue that a lot of people have after having this multi-level fusion, in their neck. Why through the front instead of the back? Because he originally had said he thought he was going to have to go through the back, and then he changed it to the front. And then why a possible discectomy? So I didn't even know what a discectomy was when he said that I have to have a possible discectomy. Well, a discectomy is where they take out a vertebrae, and they pretty much take out your vertebrae. Why do we want to do that? So I start writing all these lists. Mike and I go on a trip. I'm taking my Advil. I'm still in horrible pain, still on the heating pad all the time, and just trying to live and get through what I only have to do with work. Like, this affects you. Those of you that live with chronic pain understand what I'm saying. It affects every piece of your life. Your work, your family, your health, your relationships, everything it affects in my life in a really deep, significant way. And I'm really battling this depression. But we're on a work trip and we're in Las Vegas, and I get a phone call. I'd already told my family, my kids, our parents, everybody, that in January we're having this surgery. We make this decision that we're having this surgery. And I was at peace about it. Like, I'm okay with it. I'm geared up, ready for it. Cleared my calendar. We're ready. And then I get a phone call from his office. And she says, this is his insurance, whoever she does, that he's going to have to collect a $10,000 internal fee for my surgery, above and beyond what my insurance will pay. So above and beyond what I'm responsible for with my deductible, what I'm responsible for my out-of-pocket. And she said it was because of this fusion that I already have, the 6 and 7. And there are no codes, and there's no way for them to get paid, for them to remove that, clean all of that up, and refuse that area. There's no codes for that. They wouldn't get paid. So I've got to pay this $10,000 additional cash out of my pocket. And I thought, I can't do that and come up with my deductible and my out-of-pocket expenses. And then I started thinking about it, and I'm like, that just doesn't sound right to me. That doesn't sound right. So I posted in one of my Facebook groups and got their opinions. And then I called my sister-in-law, who works for a doctor's office, a heart surgeon, and a cardiologist, and asked her what her thoughts were, because she does billing. I mean, she's been to school to do billing, and she's coding and all of that. She said she'd never heard of that. She said her doctor will take out someone's pacemaker and then put in a new pacemaker, and he doesn't get paid to take out the pacemaker, but he gets paid to put in the other pacemaker, right? But he doesn't bill his patients separately. And then I called my insurance company and I asked them, and they were like, that isn't okay. Like, they sign an agreement with us that they'll accept these fees, and he shouldn't be charging you an additional fee. She said, I'll be glad to call him and talk to him about that if you would like. And I said, no, I'm not ready to give that name and do that yet. Then I called a friend of mine, my best friend's, it's a friend of our family, and he's an orthopedic surgeon, but not a spinal orthopedic surgeon. And I talked to him on the phone, and I said, I don't even know what to do or where to go. And he said, well, I'm not going to say anything, of course, about another doctor, but that just seems really strange to me. And I said, it almost feels deceptive to me. I told him, I said, this almost feels deceptive. And he said, well, I'd have to agree with you. And I knew right then that doctor's out of the question. Or today, it still is out of the question for me to go back to him. I just think that's unethical and it's deceptive. That's what I feel. So then I started my search for a doctor. Do I go to a neurosurgeon, or is an orthopedic surgeon better? It depends on who you talk to. Is an orthopedic surgeon or a neurosurgeon better to do spinal surgery? They both have their pros and cons. I still haven't made a decision with that. Then I was like, how do I find a good surgeon? Like, they're all good until they're not, right? Like, my doctor's office that referred me to this first neurosurgeon that did this surgery, he's great. He was great for that doctor. The doctor has since referred his brother to him. He did his surgery and it was great for him. they're great until they're not, right? And then when they're not, it's a problem. So I'm like, how, Shannon, are you going to pick the doctor to go to that you're going to feel comfortable with? And I'm really having to give that one to God. That's where I'm at now today. And so I went to my physical therapist, said, look at Google reviews, look at Yelp reviews, look at reviews on the doctors. So I started doing that. And then trying to cross-reference to the ones that the doctor will take my insurance. So in the meantime, I go try acupuncture. That didn't help at all for me. It didn't give me really any relief. Made an appointment with another neurosurgeon. I had that appointment last week, and my husband and I drive an hour and a half from us down to Houston and to see this neurosurgeon. And he was in a hurry, which I didn't love, because I like them to be invested and hear my whole story and understand, and I didn't feel like he was. And I got it, because he had an emergency brain surgery that he needed to go do for another patient that had flown. So he had enough time to tell me that he taught neurosurgeon years ago, that he had taught other neurosurgeons, and that my other doctor who I had seen would know who he is and all these things. He said, you don't need surgery. I would not recommend surgery on your neck right now. Insurance isn't even going to pay for this surgery on your neck. You've still got dye going through, is what he tells me. I didn't get enough time to even, I was so flabbergasted. Like, I go from this extreme of needing this full fusion surgery from 3 to 7 to not needing fusion surgery, two very different extremes. Like, you can't get any more extreme than you need it or you don't. It wasn't even a little bit in the middle, like just part, like, no, you don't need it. And I'm like, what? I've psyched myself up. I've got myself ready. We're all on board. Like, this is what's going to happen. He said, if you do this surgery, now some of you that have had this surgery, tell me if this is true. He said, this is a major surgery. Your neck is going to be like a bamboo stick. That's what he tells me. Your neck's going to be like a bamboo stick. I said, what does that mean? He said, well, a bamboo stick has very little give. That's how your neck's going to be. He said, and it's a big recovery, especially if they have to do a discectomy also on top of that, if they do that. And then I told him what the doctor said about this $10,000 internal fee. He said, I've heard enough. I'm telling you, you don't need a surgery at this point. Not saying you won't later. And I said, well, what about a stimulator? And he said, I think that's a last resort. And I'll talk more on stimulators later, because there is a difference I want to point out. I've learned if a pain management doctor does a stimulator or a neurosurgeon does a stimulator, if I ever did get a stimulator put in, I would never do it with a pain management doctor. I would only do it with a neurosurgeon. So explore those options if you're looking into a stimulator and decide one may be right for you. The one a neurosurgeon is trained to do is very different, more complex, and even better, in my opinion, than the one that a pain management doctor would do. But he said there were other things we could try. A nerve block. We need to have another nerve test done. Go to a reputable, good neurologist to get this test done. He said they're not all the same. And that's where I am, trying to figure out where do I go from here. And I have been getting for over 3 years massages in my neck. I have a fantastic massage therapist that I'll have on the channel to explain more about what she does. She comes to my house and she's amazing. So for now, I'm going to continue with those for every once or twice a month as I can afford to do that. And she referred me to a chiropractor. That's a hard one for me. And I don't know how this is going to work. But I've had my first appointment and I was impressed. It's not your typical chiropractor that you would go to. They practice the Gonstead method. So I will be having them on and explaining that and the whole procedure and walking y'all through that part of our journey. And I'll be doing updates. Appreciate you following along my journey and if you know somebody that's struggling, even if it's not their neck or their back, but they're just having chronic pain issues or mental health issues, invite them to follow along and subscribe to our channel. We're going to be bringing you so many things that are going to help anybody in your everyday life restore hope, purpose, faith, and strength. So I hope if you enjoy these videos that you will choose to subscribe. Be sure to comment because it really helps keep me going, and share. That's how you can help us help you